Well, I could definitely be in a better situation right now, but on a positive note, I feel like I'm on an airplane eating airplane food. Ampli and Itlo, fractured clavicle and dislocated shoulder. Let's have a great day at the hospital in Tagum. Kinamut. I've washed my hands many times. It's also connected to an IV. Let me get closer here. Yeah. I'm kind of unmobile right now on the left side of my body because of my injury. It's Sunday today. I'm gonna go in for surgery Tuesday morning, so I got about 40 hours right now before surgery. I don't know if you know this, but when I was 24 years old, I had facial reconstructive surgery. You can see my nose. Sorry. It's actually crooked underneath because I had surgery on my face due to a sporting accident. It was a lot of pain and it was very traumatic. So, you know, I've experienced this kind of feeling before. And one thing that really helped me in my recovery was, besides positive, you know, messages and, you know, help from friends around, you know, where I was and around the world, which is what you guys have been doing right now. Thank you so much. But also just having the positive belief that things are gonna get better, because they will. So what I'm gonna do is just have a little bit of fun here in the hospital and chat to you a bit about what I'm experiencing, and also give you some education about the private care I'm getting here in the Philippines, so you could just see, I guess, a little bit more about the system or what's happening. And alright, anyways, I'm eating clean because when you're unmobile like this and you have to use the bathroom, it's better to have a clean body so everything goes smoothly. That's so gross, I'm sorry. Power on, John D's coming back later. Okay, so this is gonna be the first time you get to see Dr. Dan. We'll just call him Dr. Dan, but your actual name is?
Dan.
Okay, it is Dan. Yeah, we'll keep it at Dan. We'll leave it at Dan. This is the guy who's gonna be doing surgery on me. He's actually just looking at the wound right now. But what's actually gonna happen here?
So I have to do dressing, wound dressing. I need to assess the soft tissue first. If there's infection, then I have to attend this first because we don't want any infection after the surgery. So the first thing that we should do is do a visual check on the skin so that we don't have any complications after surgery.
Okay, so this is actually, hopefully over the next kind of 40 hours before I go under the knife, I'll have another chance or something to catch up with Dan here. But John D isn't here right now, so I'm just holding my GoPro. But basically, I just asked him earlier, you know, he does a lot of surgery. He's well known around Tagum and around Davao area. How often are people who have to have surgery here in the Philippines involved in vehicle accidents?
Yeah.
That's the question of the day.
Yeah, the question of the day. Okay, so according to statistics, and even in my experience here in Tagum, we often see patients and do patients at about 80%.
80%.
In which they are involved in vehicular accident. So because of you know, the means of transportation here is motorcycle. That's why most of our patients are actually vehicular accidents.
So to be fair, whenever people message me about you know, riding around the Philippines, I completely agree. Actually, it is the most dangerous thing you can do in the country. It really is. And statistically, the most surgeries or people end up in hospitals, they come from motors or scooters or vehicles.
Yes, it's true.
Now, in my case, I was a bit different because I just made a horrible decision with my stand-up paddleboard and flew out of a truck. But you know, life goes on, and I'm sure you'll see Dan again. But he's just looking at my shoulder now, and we're just talking about what's gonna happen. So see you in the future.
Okay, bye.
Cool. Nice. the key to success. Just slap your shoulder with malunggay. Okay, actually, to be honest, in the Philippines, this is one of their national vegetables. Literally, look it up. I think the House of Representatives made malunggay a national vegetable. It's got a lot of really good properties to it. Teas, sabaw, pandesal, this stuff is full of healthiness. I have to admit though, I've heard some superstitious rumors that if you shove this into your wounds, it helps you. I don't think that's actually true. But I'm not gonna hate anybody, okay? Because I'm definitely gonna slap my shoulder with malunggay. Just for good vibes. Just for good vibes. To get back. Thank you, sir. Yeah, get the malunggay back. Change channels! Help me!
What's that?
You can do it, John D! Check, look for HBO bread.
HBO.
Oh, it's on like 40 something. No, that's lame. Go to what's the other one? No, don't do it. No, I don't want that. I don't want the cartoons. No, change channel. Oh my gosh, change channel. Like before, I'm yearning to reach the shore. Now I know. Just a heads up, if you're in Tagum City, you don't even have to be injured or in the hospital. Just if you're in Tagum City, Saladista is super good. They're salad rolls from a local lady who makes it in her house. The time I've got, it is just enough to get by. Ooh. Oh, now I know what it means to grow old. Yeah, now I know the time I've got. Okay, so it's the evening. I didn't go around or anything. Just chilled in the room, watched TV, ate some food, did some malunggay good vibes. Now John D is making me a cup noodle. What a bro. John D's staying with me right now, guys. Kumar and Commander are back in Cateel I. He'll be here for my surgery, but I think the guys are gonna come visit tomorrow as well. What a bro. He's gonna come through that door soup. Yes. Yes. Nice one. This is the best part though. I can't physically get over and move the bed, so you have to crank this bed. It's a nice, comfortable bed, but it's not electronic. It's a proper crank one, and you're gonna see John D do this in a sec. That's the best part, man. It's the best part. Oh, my wound smells so gross. The back. Just not one back wound. It's fine though, it's fine. It just smells gross. What?
Will.
Oh, you close that? Yeah. Dress me, sir! Oh, it hurts to laugh like that. Yeah. So if you've never been involved in a serious accident that maybe involves you getting surgery, you're usually not so mobile, which is why you need people around to make you soup. And can you crank the bed, bro?
Yeah.
Excellent. Crank that bed. A little bit more. Yeah. Ayan. Oh, perfect. Whew. That's John D sleeping. It's hard to vlog. Ano mo pangalan?
Lois po. Katong last.
Ah, sakto.
Opo, close.
Alright, game. This is the vitals check. Diba? I think. I've been getting 120 over 80 every time. But now maybe because I'm vlogging it'll be different. Kumusta, Brad?
Okay na, Brad.
Ah, yes, nice one. She's so serious. Try. Oh.
110 over 80 po.
110 over 80. So I lost 10 because I was vlogging. Char. Thank
Salamat,
you.
sir.
Salamat. Thank you guys.
Welcome po.
That's a typical thing. It's a vitals check. So thank you. I'm paid.
Thank you.
Okay.
Oh, hello.
No, not even a small water, not even a sip of water. Kaya ang purpose na ng class, because you're going to go to sleep. Full sleep talaga. Meaning your reflexes, gut reflexes will be affected. Hindi na ka kaya tulog ka. So kung nakainom ka o tubig, or nakatarong ka gamay, pwede siya magbalik o mag-regurgitate.
Ah, siya sinikama.
Asa man siya makanto, makanto sa inyo.
This is cool. That was Charlie. He's the anesthesiologist, the guy who's gonna put me to sleep. The gas is gonna be called Sarah Flynn, or I can't remember the name, starts with an S. But he's the brother of my surgeon, Dan. They're brothers, and they do this. That's so cool. That is, Jundit, tell everybody how cool that is.
Oh,
It's cool.
it's very cool.
Hey, look, anyways, moral of the story, it's gonna be good. He's gonna put me to sleep.
thing is, we eat.
We have to eat. We can only eat until this evening, and then I can't eat. That is all. What do you get? Ooh.
A lot.
Tagum pie.
Should.
After placing the implant, after 2 weeks, we need to remove the stitches and we need to start the rehabilitation period, or the rehabilitation phase. So the rehabilitation phase will focus on the range of motion of your shoulder. And afterwards, after getting the good range of motion of your shoulder, then we need to strengthen the muscles. Because I want you also to be strong. Be back on your, be back on with your element, right?
Yes, absolutely.
So after a while, you just enjoy for a few months of your plates inside your body. Yes, you need to remove it afterwards. Yeah. After a while, then we need to remove the plates.
What I'm wondering is, when you remove it, do you get traumatized again, or is it pretty?
Yeah, it's the same incision.
Yeah.
So we will gonna pass on the same incision. So line of incision. So on that line of incision, we can expose the plate, and then we can see the plate, and then just remove it. It's very easy to remove it. But well, in fact, early this morning, the first surgery that I did was a removal of the implant on the tibia.
Ah, okay.
So I removed it.
Do you get to keep it? Like, is it like your? What do you do with an old implant?
No,
Like,
I'm giving it back to the patient.
no way. Okay, cool.
You can keep the.
That's what I mean. Is I can like put it on a mantle and be like, have this in
Well, you can use it as a pendant.
Yeah, cool.
Your necklace.
I literally haven't left this door in 3.5 days. It's over here, no? Which way? This way? Here? They're gonna freak out when I'm walking. Don't worry, I'm good. I came for an adventure. Thank you guys. Have a good night. Oh, it feels so good. I have to enjoy this moment because I haven't actually walked outside, and I know I'm getting surgery tomorrow, so I'm gonna be back in that bed for a few days after. Let's go to the window. Oh my gosh, the window. Again, this is a private hospital. It's pretty relaxed up here. Oh, the window. I promise you, if we ever come back to this window, it'll be during the day because you can't see anything. Anyways, surgery tomorrow morning, positive mind, good vibes. And Jundi, thanks for holding this. Me. Thank you guys. Good night. I put ensamadas dito. Ensamadas. Are they ensamadas? I think they are, huh?
No, mamon.
Mamon? Oh, it's mamon?
It's mamon.
Ah, what is that? What of myself? Ayan. Hello. Yay. Hello. Hello, friends. Hello. Hello, friends. This is okay lang kayo. I talked to the doctor and they let me vlog before going under just to share with you again. It's all about positive mental thinking. That'll help you, and it will also help everybody else around you in the medical field. Selfie. Ayan. This is actually very comforting before surgery that I'm vlogging. I really like this. Ayan. Okay. I'll leave this for Doc Dan. Alright, so I'm about to go under. The anesthesiologist, who happens to be Dr. Dan's brother Charlie, is gonna put me to sleep. So I'm gonna go on a happy little adventure, and when I wake up later, I'm gonna have a cool plate in my shoulder and begin the road to recovery. So thank you everybody, and see you on the other side.
I never felt tomorrow closing in this fast. Oh, I guess time's in a rush. Leaves are falling down, but at least they grow back while I'm on a one-way track.
I'm just waking up from surgery. It's over. The doctor is amazing. He came up to me. I'm starting to get into pain now. Yeah, it sounds really successful.
The time I've got, it is just enough to get by. Yeah, it is just enough to get.
Hey look, I'm awake and I'm moving back to my room and there's Christmas. I'm back in Christmas. Thank you guys. Yeah. That was really successful, I think.
But you will be back here by after 6 months, right?
Oh, exacto. Well, I got a lot of work to do now, recovery. But stage
plates.
Oh, stage 1 no. Stage 1 is humana. Stage 2, pass through Christmas land. Whew. I like this. I like how you come out to Christmas. Let's go.
RRT, what's ang concept dapat? RRT.
What's RRP?
Yay! I'm awake. Look at it, Santa Claus. I found the North Pole. Sure.
What it means to grow. Yeah, now I know the time I've got, it is just enough to get by. Yeah, it is just enough to get